Hi, everyone. This is Amanda Wright. I am the marketing coordinator here at Get Real Health, and I will be serving as your host for today's National Client Conference session in conjunction with our parent company, CPSI. I'm here with Robin Wiener, the president and founding partner of Get Real Health, and we are excited to welcome you to our United States Roundtable. When each of you joined today, your audio is muted. We have a packed session with 3 great speakers, but we have 15 minutes dedicated at the conclusion of the presentation for the roundtable discussion. At that time, you'll have the ability to raise your hand to be unmuted, and you'll be able to ask any questions to our speakers and any other attendees. The button to raise your hand can be found in the top right-hand corner of the Q&A chat box. You may also submit questions anytime during the session. You do not need to wait till the presentations are complete. You can do so using that Q&A window at the bottom right-hand corner of your screen. Since the question and answer period will be at the conclusion of the presentation, please be clear and comprehensive when submitting your questions. And if you have questions for a particular speaker, please say so when submitting. We do have a record of all of questions submitted, so if we don't get to your question, those unanswered questions will be answered in the coming days. So with all of the housekeeping out of the way, I would now like to introduce our speakers. We have Scott Young, who's the Senior Director, Product Strategy and Growth for Rhode Island Quality Institute. Darren West, the Support Director, Clinical Service from our parent company, CPSI. Katie Tully, Project Manager, Chesapeake Regional Information Systems. And then we will end the roundtable discussion moderated by Robin Wiener, President and founding partner at Get Real Health. So first, I will turn it over to Scott, who will let you know about our work with RIQI.
Great, thanks, Amanda. It's like, I guess I'm going to be getting control here shortly. I could show you my presentation.
You should be able to do that now.
Great, okay, hold on a sec. Fabulous. Well, good morning, everyone, and thanks, Get Real Health, for giving me the opportunity to talk today about the many tools that we offer through Get Real Health for the Rhode Island population. It's been a pretty long road with you folks. It's been a great relationship. I'm the Senior Director of Growth Strategy and Growth at Rhode Island Quality Institute. We are the statewide health information exchange for Rhode Island, and we offer that health information exchange to our provider community for approximately 1.1 million Rhode Islanders through a variety of services. The purpose of the site that we worked with Get Real Health to develop a few years back is really to obtain patient-generated data for a variety of use cases that were identified by the state of Rhode Island, specifically around uploading of documents such as advanced directives and the taking of assessments and surveys. Initially, we looked at social determinants of health as the kickoff survey, but we've also developed substance use assessments, et cetera. We're going to talk a little bit about that in a second.
Scott,
yeah.
If you have a presentation up, we're not seeing it right now.
Oh, you're not seeing it?
No,
Okay.
I'm so sorry. Yeah.
You know what? I mean, if it would work better, I'm okay with if you just show the
The one that we sent out.
Let's see. If you show the slides, and I'll just tell you to click through, it's fine.
Amanda, can you go ahead and do that?
Yep.
Can everybody hear me okay, though?
Sound great, yeah.
Absolutely.
Okay,
Yeah.
great. Okay. Yeah, not a problem. Sorry. Great. So the purpose of our site, which we call Know My Health, specifically because it is patient-facing, and we really, the main objective was, again, to obtain patient-generated data. And So there's really a couple ways for access of that data. For the purposes of these programs with the state of Rhode Island, they were all initiated through providers and provider offices specifically. And even though there is a potential for going direct to the patient, but for purposes of the site as it's being used right now, it's being directed through providers. Once that information from the patient is obtained, it's available within that network, but then we also send that data to the Health Information Exchange Current Care. Good, next slide, please. So yeah, what is our target population? Well, really, it's any provider who's treating patients in Rhode Island. So it's not necessarily just Rhode Islanders, but it is predominantly Rhode Island residents. And then within that is it's very targeted around state grant participants, specifically primary care providers, care management teams, community mental health organizations, and substance use screeners, expert screeners. I'm going to talk about that in a second. Okay, next slide, please. So what are the three things we're trying to achieve with our site? Well, number one, when we first started this through a grant from the state innovation model funding that a number of states received, was to promote the use of advanced directives, use and sharing of advanced directives. So number one was accept and share advanced directives. End of life planning was the first use case. And then the other ones were around gathering self-reported data through a variety of assessments, including developing an expert screening tool for substance use and depression as part of a grant. And then also the capability to upload something called a GIPRA form that is required as part of those grants to SAMHSA, who is the overarching organization who funded the grants through the state. And then working on currently with Get Real Health, the COVID-19 symptom tracking tool, a daily tracking tool for a grant that we were funded for through NIH. And then finally, it's not only the filling out of those GIPRA forms, but we also built in the capability to upload those GIPRAs to the SAMHSA site to meet the grant requirements, which is something that is, I believe, fairly unique in the work. I think there's only one or two other organizations that can actually do that. So, which saves a tremendous amount of time for the grant participants. Next slide, please. So, what did we learn from our experience? Well, first and foremost is that really adding features incrementally is critical, instead of trying to do it all at once. You know, those as we went through this process, we built the relationship first to do the SIM grant funding, which had some very specific uses, and then we started to build on with different requests from state government for other types of features. So, but we learned a lot as we went on what was needed to do this. So it was a little bit fly by wire. So, and then second is ensuring true buy-in by those organizations who have expressed early interest in doing this, but then when it comes down to it, it didn't work for their organization. Specifically, I'm referring to a social determinants of health assessment. When we actually went out to the community to try and figure out how to go about doing it, the interest level had already waned because those organizations either already had that social determinants of health assessment built into their EHR at that point, or they had built one themselves. So the need was really no longer there. We don't necessarily think that that's going to go away, that we think that that capability will be utilized in the future, but not for the purposes of that specific grant-funded project. And then finally, leave extra time to find undocumented errors in external systems, and specifically interacting with the SAMHSA SPARS upload system was a challenge. So, and we didn't factor in enough time to care for that. Next slide, please. What do we wish we did before we started? Well, I think number one is the capability to verify and identify patients outside of the point of care is a capability that is really critical, especially moving forward. And it hasn't been part of the model for engagement in these types of tools. That would have been great to have had. How to export two versions of the survey to compare side by side for those for the administrators of the surveys is critical. Something that we really would like to see is the ability to manage duplicates. That's something that we're pretty familiar with and we have within our systems, but was not within this system. So that duplicate management capability in our environment, because of our model, is critical as a health information exchange. And then our system capabilities in the HIE to accept and display discrete data around these data types was a limitation. We really didn't know that before we went into this engagement, and so we had to come up with workarounds to get that information into the HIE so that it was usable. And specifically, instead of a discrete data element, we had to put it into a document form, a PDF, so it could be viewed. Next slide. So how do we engage our participants? Well, how do we engage the patients? Well, really, it's the participating providers through these grants engage the patients directly at the point of care. It's really the only way for now. For the symptom monitoring project, we'll be sending multiple reminders if the survey that they're taking is missed. But really, right now, the main engagement point is through providers who are incented to engage in this in the program. Next slide, please. I think that's it.
Yep,
And so that's great. Thank you. And next presentation, I guess.
Yeah, thank you, Scott. We are now going to transition to Darren from our parent company at CPSI to talk to you about MyCare Corner.
All right, thanks, Amanda. Today, I'm going to share how CPSI as a software vendor is rolling out a patient portal called MyCare Corner to our acute facilities on our two EHR solutions, one called Centric and the other called Thrive. We do have right now 120 facilities in 31 states utilizing MyCare Corner. Most of our facilities are in rural America with an elderly population. By the end of 2021, we are expecting to have over 600 facilities utilizing MyCare Corner in roughly around 40 to 45 states. So we're continuing to, in 2021, continue that rollout. The purpose of MyCare Corner is really driven to encourage the patient engagement and to put the patient pretty much in the center of their own medical care. We do this by giving them, access to their data 24 hours a day, where they can engage and work directly with their care teams at their facilities. Patients can also stay informed and directly communicate through the portal directly back to their care team, not only for themselves, but they can also connect their families to their profile as well. So spouse or children can be connected to their profile, and they can help manage that care for those in their family as well. We also, with promoting interoperability, we're able to assist our facilities in meeting some requirements there, specifically around the VDT, or the view, display, and transmit requirements of that requirement, or of that regulatory requirement, and ensuring that facilities can continue to meet promoting interoperability as changes come for that here as we go forward. What are we attempting to achieve with the site? So patients have access, again, to their health record, either through a mobile app or through the web browser. So keeping that at their fingertips. We have seen with the mobile app some feedback from our facilities that they really appreciate it, especially for the younger generation, being able to send messages directly through the mobile app to their care team. They feel that the younger generation has grown up on apps, so utilize it a lot more. But we've also seen with some of our elderly areas, them embracing the mobile app as well, having that information directly there for them when they do go into a physician that may not be at a facility. They can bring up that information within their mobile app and share it with that provider there. They're also able to, if they get information, load it into My Care Corner. So they have a central location for all of that information, and they can share it with their care team securely through messages as well. We do have the ability to connect several health devices to My Care Corner. Again, allowing all of that information to be centralized for that patient. So should they want to share that with their care team, they have access to that and can quickly share that with them. We are in some discussions. There are some some challenges with having all that information in My Care Corner and getting it back to the EHR. We don't have a good way to reconcile that information yet, but there are some discussions on, if a patient has all of this information in My Care Corner, how to get it back to the EHR so that the physician can quickly, or the care team can quickly see it outside of sending messages and that sort. So some things we're still looking at there. The other thing with My Care Corner is, as the elderly population, they may want to share their health record with their family or their kids to help maintain their care. They can securely share all of their health record within My Care Corner, or just pieces of their health record that they want others to know about. So My Care Corner does give them the ability to do that as well. We do allow patients to, like I said, securely communicate with their care team, but we also allow secure communication around like general questions. Maybe they're getting a statement and they have some questions for the business office. They can communicate securely through the portal to the business office. If they have some appointments scheduled and they need to cancel or reschedule, again, they can do that through the portal. And then also if they have any medications or pharmacy refills that they need, again, they can request that through the portal to their care team and get that done that way versus calling in and waiting for a response there. What we've learned from our experience, as I shared, we got 120 facilities that are up and running. It was key early on to engage the right facilities, to talk through the integration from the EHR, also talk through what functionality would be coming, outlining plans as far as workflow within the facility that was changing, or not changing, and making sure that, as registering a patient or where messages will show that information was flown through the facility so that the end users knew what was changing. So early on, we engaged a small team to help us with all of that documentation and really helped us ramp up and roll out the My Care Corner solution quickly even during the COVID season here early on when we got hit in March with that. We do, part of that is engaging the IT teams at both the facility and, your EHR, just to make sure that everything is getting securely transmitted between the EHR and MyCare Corner as well. We also learned that dedicating a small team within the facility once the solution is up and running to really help promote the patient portal with the patients and getting them registered quickly versus just sending them and saying, hey, we got a new patient portal. Again, we want the patient owning their pieces of this. So having a small team dedicated within the facility to either register patients bedside or once a week following up with patients who may have been asked to register and haven't. Maybe they're running into some issues to help promote the solution as well. And the last thing that we learned is keep it simple. And one of the things with Get Real Health is there are a lot of widgets already predefined, which helps with keeping it simple and just putting those widgets on the page in the right place so that patients aren't having to click in multiple areas to get to something like communications really helps as well. So something that as we were going through this is just keeping it simple and the information in front of the patient was really good. Some things that, we wish we knew before we started, and I think we kind of knew this, but it was really coming to light. As I said, we're in 31 states, and each of the states have different requirements as far as it relates to minors and what minors can see. Some states protect minors as young as 10 years old from sharing information with their parents, such as pregnancy tests or HIV tests. So making sure that if a parent does have, or a guardian does have a profile set up in MyCare Corner and they include their family members on that profile, making sure that that information was not shared because again, due to regulatory requirements and minor protection, we needed to make sure that that information wasn't flowing over to MyCare Corner. And then we also had some things where some states protect minors at a certain age. When they reach the age of 16, they're considered an adult and their parents no longer should have access to their patient information. So we also put in some checks there to auto decouple a minor's account from a parent account at a certain age. And then also had to make sure that, if the minor does want to still share their information after that decouple process is in place to ensure that we can either link the account back up, or our recommendation is using that share feature so that the minor can have a little bit more control of what the parent sees as well. And again, that's based on regulatory requirements in each state. Data is shared real time, and once the patient logs in, the system or MyCare Corner will automatically pull information from the EHR pretty much in close to real time through the back end. And some of this can get a little bit challenging when you get into lab tests or radiology tests where the primary care team hasn't had a chance to review the results prior to the patient seeing them, and that can cause some anxieties if the patient misinterprets some of those results. So we have put in some parameters and checks within the EHR system to allow the care team to finalize those results prior to sending them over to the portal, and then also looking at sending the results after a set number of days, because along with this, we got to keep in mind information blocking and got to make sure that information continues to flow over to the portal in a timely manner, but again, giving the care team an opportunity to review that information prior to getting to the patient. How do we engage our patients? And we really work with our facilities to do this part. We work with our CPSI marketing team and the facilities to create posters, flyers. We also, with the registration, bedside registration. For the facility website and social media, we've created recordings that they can put on their websites to promote the site, and then also to walk them through the site or walk patients through the site so they can see how easy it is to navigate, and really encourage them to sign up for My Care Corner with their facility. And with that, Amanda, I will turn it back to you.
Great, thank you so much. And now we are going to have our final transition to Katie, Chesapeake Regional Information System, for our patients to talk about our work with CRISP and what we will be launching there soon.
Great. Give me a second to pull my slide.
As Katie's bringing that up, little weather report from Rockville, Maryland. It's starting to snow here. So for everybody on the East Coast and all our guys overseas, we're starting our big storm. So we're excited.
All right, great. You should see my slides now. Sorry, it took me a second to find it.
You're good to go, Katie.
All right, so before I dive in, just to give everyone a 2-second overview of CRISP and my role. So as was introduced, we are the Chesapeake Regional Information System for our patients, otherwise known as CRISP. We're the regional HIE for Maryland, West Virginia, and the District of Columbia, and are receiving data from all acute care hospitals, as well as several other data points, including COVID-19. For the presentation today, I'm going to be focusing on a project specific to Maryland. So we engage Get Real Health on a project that our partners at the Maryland Department of Health approach us for to really solve a core problem where the state's running these COVID-19 testing sites, but the lab that's resulting these results is pretty frequently changing. And some of these are new labs that don't always have patient portals. So there's kind of a core need to have a tool of last resort that they could use to deliver results to patients. Because in the absence of that, you have a phone-based process where today, the Maryland Department of Health is, for places that don't have a portal, they're having to call these patients, which creates a number of problems with patients not being able to actually have those results in their hands. So because CRISP already was receiving all of the lab results that are reported into the health department for a number of other projects, they approached CRISP to say, would you guys be able to stand up a portal where a patient could log in to access results from any testing site, and really where they could even go in and download all their COVID-19 test results in one central location. And so we engaged Get Real Health to create that portal. And so, as I was saying, really the target population for this, hypothetically, is that we could roll this out to give patients access to all their test results for any patients that tested in the state of Maryland. As this project progressed, we really narrowed in on a patient population of those who are receiving tests at community testing sites in Maryland that don't have those existing patient portals. And so really the three things that we're looking to achieve with this is, one, provide a place where a patient can log in to view these records, to take volume off of those call centers and to allow them to have those results in their hands. So say they can print it out, bring it to another provider, or have it to say show proof of testing. We also want to have a really streamlined way for patients to access those results from multiple testing sources. So at different testing locations, you're using different labs. As I'm sure if anyone here has been tested for COVID, you might have access to 6 different patient portals right now with different COVID-19 results. So it really provides a central place where a patient could go to download all of their results for COVID, if they're resulted in Maryland. And then lastly, as I already said, I think the feature to print out the results is a really key part of this as well, because that enables them to have those results shown as proof of testing, as opposed to having to call the health department and some complicated workflows that are in place today that is a suboptimal experience for both the patient and for the health department. And so, as was mentioned earlier, we're actually working on piloting this in January sometime with community testing sites. So we don't have this live yet, but I think already in preparation for that, we have learned some really core things. So the first being, I mean, this is CRISP's first foray into really providing patients with access to data through CRISP. And thinking about that from an operational perspective, a very different problem to solve than our typical provider-facing tools. For instance, identity and access management is something I'll dive into a bit more, but that kind of core question of if you're an HIE that doesn't have direct patient care, what's the best way to verify that this person that's logging into your portal is who they say they are? And so that's kind of a core piece. And then with that comes kind of some complicated factors of what if we're using a LexisNexis-based solution that's based off of tax records? What if a patient doesn't have a lot of credit history, so minors or even people in college? So we had to think through a lot of those scenarios in creative ways to figure out how are we going to support that from an operational perspective. If someone can't get access to a tool but needs access, how do you want to vet those populations? So it definitely has been an interesting learning experience even so far in terms of thinking through different type of questions that we're used to at CRISP. The next one is really that, I mean, data quality is always a really important issue that we're working through at CRISP, but I think this use case brings particular emphasis on that. COVID-19 test result data, as many people on the call probably know, it's pretty sensitive data in terms of patients obviously want to know accurate test results, and a positive versus a negative has huge implications on the patient. And in CRISP or any HIE in master patient indexes, there are scenarios inevitably where a piece of data is submitted that cause what we call a patient merge or an overlay. So as we've been thinking through this, we've done a lot of due diligence to QA our data, both within the portal against our other data sources, and to try to understand any problems with data quality so we can proactively address them and have a process for moving forward when we start to roll this out to the public. And then lastly, I think this kind of extends to any COVID-19 related projects, as I'm sure other presenters on the call can relate, is that when working with health department or other stakeholders on COVID-19 projects, it's really important to be flexible and responsive to the ever-changing needs. As I mentioned, I think when we started off in this project, we had one use case, but then it kind of evolved. And I do think the Get Real Health team was very responsive to that. But I think it just highlights that health department partners and others are really responding to the situation on the ground, and the needs for some of these tools are constantly changing. So being iterative is always a value of CRISP. I think particularly for this, you have to be willing to really work with your partners to kind of change and respond to ever-changing scope. And so as I started to get into earlier, I think one thing that I wish I knew before I started was really having a better understanding of that identity and access management space, and specifically how it applies to healthcare. I mean, I would argue even COVID is kind of a subset of healthcare within identity and access management. There isn't a set in stone standard for how someone would verify someone's identity. There is NIST level 2, but even that has different levels of interpretation. So I think for us, once again, as an HIE that isn't making that direct patient contact, it raises a bunch of questions of how do we verify this patient's identity? And I think we got a crash course in this early on in the project. I do think coming into it, it would have been great to have a better understanding of the space and what other HIEs were doing. And lastly, the question of how we engage our patients, I think when I was talking about this before, I think, as I mentioned, this is really our first foray into giving data directly to patients. So this is kind of a new area for CRISP, but this is changing due to the info blocking regulations through the Cures Act. So CRISP is engaging in this, but this is really our first time doing it. So really we're relying on the direction of all of our state partners, including the Maryland Department of Health. So any marketing material is going out to them. We let the health department take the lead on that in terms of promoting the tool, determining the best target populations, and having that direct contact with the patient. Beyond that, looking ahead to kind of all the efforts that are going to need to come to comply with these regulations, we're broadening out a bit and collaborating with our partner hospitals. We also do have a patient engagement committee that's staffed with patient privacy experts who are really driving our work with our patients and bringing that really important perspective, because as I said, patient engagement is a much different space than the provider world. And we're definitely leaning on our stakeholders and experts in the field to understand how to best engage patients in the space. All right, and I think that's it.
Great, thank you so much, Katie. And at this time, I will pass it over to Robin Wiener for the roundtable discussion portion of the event. Just a quick reminder, you have the ability to raise your hand to be unmuted, and you will be able to ask any questions to our speakers or any other attendees. And that button to raise your hand can be found in the top right-hand corner of the Q&A chat box, and we will take you off mute for that discussion. You also can ask a question through the Q&A window at the bottom right-hand corner of the screen if you so choose. So, Robin?
All right. Well, good morning, everybody. We're excited to have our great speakers today, and I know that this is a very, very busy time of the year, and also with COVID happening, that they were able to take the time out. I know that our friends at CRISP have been extremely busy with just getting out the vaccines that are happening now, and we are thrilled to have CRISP as part of one of our partners and clients, since we live in Maryland, that we are in Maryland. So it's very exciting to finally have something right around the corner from us that's actually going to affect my family and our friends and et cetera. So we're really excited about having that partnership. That's a new one for us. So we're looking forward for them to go live in January with us. So I thought I'd throw some questions out as we're waiting. And I thought I would start off with Scott. Scott, you've been one of our clients for a long time and one of our partners in all this. What kind of suggestions would you have for other HIEs out there?
You know, and actually it was really interesting to hear Katie talk about experience with patient engagement. We actually almost 4 years ago established a patient portal access to the HIE, so completely untethered. And so we've learned a lot over the years, and you know that HIEs have never really been required to provide patient access to their HIE record, and now they are, I think, to Katie's point. And so what does that mean? And we've learned a lot over the years around that. And not necessarily, you know, build it and they will come is not necessarily true. There needs to be some reason for them to come and access their data. And actually, you know, what you're doing right now, you'll probably find that there'll be significant demand to get people to actually sign up, and because they have a need to see their test results. And we found out that same thing because the state used us as a, they linked to our patient portal patients who were being tested through the state. And we were overwhelmed with demand at that point. And unfortunately, they had to enroll in the HIE first, and then into the patient portal. So we learned a lot over the last 6 months because of the pandemic. It was really, it went from being, a nice thing to have to being, you gotta have it. So there's a lot of nuances with an untethered patient portal, which, Get Real Health understands this concept. Not everybody does, and the identity management is really tough. When you take it out of the point of care, provisioning process, it gets sticky. And then also the issue around minor access is another one that is really tricky. We don't provide access to anyone under the age of 18 to our patient portal or to Know My Health. So, there are things that we have to, as an HIE, get with the times, basically. But there's got to be a demand. There's got to be a reason for them to come and access the data.
Absolutely, and we're seeing that. So one of our largest clients is the province of Alberta, Canada, and they are also delivering all the COVID tests through the portal. And we have seen a huge demand. Now, granted, they're a province, so they've got 5 million people in there, but we're seeing sign-ups in the scheme of about 70 to 100,000 people a month signing up to be able to get the results. And this is just a huge increase over what was there before. So it's and they're also an HIE per se, they're connecting to HIE. So it is the same kind of concept, but it is getting through all these ups and downs that we're able to figure out during the COVID times. Hey, Katie, we've got a question from one of our partners over in the Netherlands, actually. And what Jan's question is, I know we're really early on this right now with Chris, but down the road, are there plans to getting the patients out of the hospitals faster by sending them home and being able to monitor that, like their saturation meters and monitoring them through platforms like Get Real Health? I'm not exactly sure if that's a real match for you, but have you had any conversations within the state on being able to do more of that monitoring from afar, being able to get that information?
Yeah, it's a great question. I mean, I think that's more something that would be a use case for the individual hospitals, not for CRISP. So for instance, like our partners at UMS and Hopkins, I think that would be more of their role to have a patient go home with certain telemetry, telehealth coming into play there. And then them working with the health department to then report back any of that information. So I'd say that'd be more of the role of one of our partner organizations. I don't really think CRISP is situated to support that type of patient monitoring.
So, Robin, it might be a good opportunity to talk more about the symptom monitoring tool that we're developing with you. For a grant. And so this is specifically around COVID-19 symptoms tracker. And so we're doing this as part of a test grant with NIH and specifically targeted at the Latinx population in Rhode Island and getting access to testing, but also tracking symptoms as well. So, and we're not the only ones who are providing these symptom monitoring tools. The question is then connecting them into the overall network is a lot of the symptom tracking tools don't do that. They just stand alone and they're not really linked to the individual's overall health record.
Absolutely, and I think you guys are thinking about doing that. I think the next step is for the vaccine. I know we've had conversations.
Exactly, yeah, that too.
because I think that's the next step that we're seeing. We're already getting requests very quickly from almost all of our partners to be able to have a widget on the front page of any of the patient portals that say that you've gotten the vaccine. Because of course, as it goes forward, as you're being entered into, I don't know, going to an event here in the state of Maryland, going to the University of Maryland basketball games and things like that, we're starting to see that the conversations are out there to be able to have that, so you can walk up and have a code that says you've got the vaccine. And we joke around here and say, you know, our Governor Hogan says you're good to go, you can go to the game, that kind of piece. So we're seeing that already, got requests coming out of Canada for that immediately. And we have the ability to do that quickly by utilizing some of the basically the immunization widget that we have, but we're going to drop it on the front page so you can have that and the patients feel very secure that they have that information right in their pocket, which I think is important. And getting back to that's why it's so important to have the mobile. And Darren, talk a little bit about maybe what it's meant to have getting that mobile app finally out. And I thought it was really interesting that you were talking not only the younger population, but the older population is utilizing it. And we've seen that out in the marketplace. Do you have any thoughts about that? And especially now that we're getting with the vaccines and the COVIDs and everything like that, I imagine that's going to be a big piece.
Yeah, definitely is. And, you know, one of the key pieces of being able to communicate with your care provider is also getting those COVID results back from your care provider. So we're able to, not only with the mobile app, but with My Care Corner in general, that quick communication. So the facility is able to put on their letterhead a document saying that they got the COVID test and securely send that back to the patient. And they can bring it up in their mobile app and either print it out or get it over to their facility or to their employer. But yeah, we've heard some great things of being able to, again, connect other devices like Fitbit or Omron for blood pressure and have that quickly display in the mobile app itself. And when the patient does go in to see their care provider or care team, they can pull that information right up on their mobile app and show that to the provider. So we're starting to see more and more, not only the younger generation, but more of the elderly generation utilizing it.
Yeah, and I think it's interesting that there, you guys are in rural America. You know, we're talking the other two, like state of Maryland and Rhode Island, we're pretty big areas. So it's interesting on the rural side. Are you seeing? Have you heard any feedback from your patients or the clinics that having that information in the hands of the patients as they're out there and being able to communicate in a better way, is that helping with, especially at the COVID time and during COVID, where you're maybe not going into the hospital as much, being able to get those results in hand? Are you hearing any kind of feedback? Because you're in a different area than a lot of other clients are.
Yep. Yeah. So I think you hit on it. I mean, we're able to, or the patients are able to not have that contact by having to go into the facility once they have their COVID test. They can get those results back directly through the app. I know we have one facility, I think has over 6,000 patients now registered, where they strictly communicate everything through the communication of the mobile app, so that they limit the exposure at the facility itself. So again, it's starting to, I think, just become more evident now with the COVID pandemic on how to build tools to limit the exposure to some of these things.
Do you think healthcare has changed due to the pandemic? Do you think it's going to go back, or have we changed?
I think we've changed. I see a lot of regulatory things coming out around expanding the telehealth visits and that sort. We do see a lot of our physicians now using telehealth versus actually, the in-person visits. So I think it's changed, and I think it's going to continue to change, and telehealth is going to become even a bigger part of the future of healthcare.
And what we've heard is last year they did 1 million telehealth calls. in the United States, and this year it's going to be over $1 billion. So it's going to be credit. Scott, what do you think? Do you think healthcare is changing?
Yeah, absolutely, it's changed. To your point around telehealth, that's huge, and therefore the providers' receptivity to technology out of necessity is we're seeing a big change around that, and attitudes around technology. And I think with the evolution of FHIR capabilities, the ability to develop APIs to be able to go in and pull data from these larger data sets for all types of different applications, I think it's just going to explode the market for these types of tools in the future.
I agree. Katie, do you have any thoughts on that? I know you guys just had your user conference last month. Was there lots of conversations around this?
Yeah, I mean, I think from CRISP perspective, I mean, I do know in terms of the type of work that CRISP is engaged in, even that has seen a pretty drastic shift over the months of COVID. So obviously public health has taken a huge, a bigger role within CRISP's operations. And I think it's kind of shaping the role of HIEs specifically in the future. And I know other partner HIEs have also had that expanded role to support public health in the future. So I think from the HIE standpoint, I think this pandemic has kind of highlighted the need and utility. And I think moving forward, there's going to be some efforts and greater, hopefully, greater recognition of their space of HIEs as like a public health utility.
I 100% agree. I think I think you touched on it before, where there are so many patient portals out there that having one that you feel like in your state or in your province or et cetera, that is the one place you can get the information from multiple places is going to be really important down the road. So you have one sense of truth, because I go to Johns Hopkins, I go to MedStar, et cetera. So I always find it great when I go in and they have all my medical information, because Chris has pulled it all together for me. So I think on the patient side, it'd be great too to be able to see that. I think the last question I would have is if anybody has any feedback from patients. I'm sure, Darren, that you've had any feedback yet, because you guys are signing up patients so quickly right now.
It's tough because as a software vendor, we usually, the facilities have that direct contact with the patients. But all in all, like I shared, I mean, what we're hearing is that they're really liking having all of this information, the patients, right at their fingertips. And I think also the facilities are starting to adapt to that and having a lot more of that direct interaction between the patient and the care team or the provider at the facility. So some limited exposure, but what we're hearing from facilities is it's really starting to gain traction with patients, and they're really, really enjoying having their information right there.
And we're excited. For people to understand, CPSI is our parent company. So one of the things when we joined them about 1.5 years ago was to give them this new patient portal, and we're so excited to see it kind of starting to roll out across all the states in the United here in America. And I think we're going to learn so much, because we're going to have such a big, large, diverse population, and hopefully we're going to be able to do this in person next year. And what we'd love to do is invite everybody to come to, I'm not sure where it's going to be, Bailey. I'm hearing some rumors, but I'm not sure where it's going to be, and have everybody to come, and we can do this in a room and maybe even over some dinner and some cocktails and have one-on-one conversation, because that's really where the power is. It's hard to do it virtually. So we're looking forward to being able to do that with everybody next year, bringing hopefully our international players in from Europe, from the Middle East, from actually down under in New Zealand, Australia, and of course Canada, and bring everybody together to have a really deep conversation. But I just want to thank our panelists today for everything you've done. I really, really appreciate it. And I know I want to say to one of our newer clients, Vicki, who is out there, good luck in Pittsburgh, because you guys are going to get hit hard today with snow. So enjoy your snow day, make some snowmen and enjoy it. So I'm going to pass it over to you, Amanda, for you to wrap it on up.
Yeah, sure. Thank you, Robin. And thank you, everyone, for joining us this morning. And a special thank you to our speakers today. Yes, so you'll be receiving an email with a link to this recording. Please share with anyone that you think would find it interesting. And if you have any feedback about any of the sessions, please respond to that email. We'd love to hear from you. And thank you all for joining us. Have a great day.
Bye-bye, guys.